Muriel is asking us also a question. What is really important to take into account if you want to change a standard of care treatment with your application? With the typical struggles of reimbursement, prescription need, and changes are decided by each single doctor and not by hospital policies.
Okay, I can start with that if you want. So in fact, that's indeed today's challenge, where multiple doctors, multiple healthcare professionals are supporting patients on different aspects. Well, this kind of care collaboration and care coordination across different healthcare professionals is indeed a challenge today. Where digital health can come in and support that is, in fact, to provide information to each of the healthcare providers that are involved with the patient, so that, in fact, availability of the data all the time on insights in the patient and the data produced is possible. But also in terms of how to better organize diagnosis or even optimize disease management. Also there, the digital health component can play a crucial role. If you want to further personalize treatments, today it's complicated if multiple doctors are working around the patient in different locations from different organizations. Digital health allows, in fact, to cross borders between the different healthcare providers.
Yeah, and if I can comment on that also, Andaman is, for me, one of the first, if not the first, electronic health record that has been conceived as a distributed system. So it's a real strong paradigm shift, actually, because today you have EHR in hospitals that send and receive data to other systems, but they consider their system as the core, as the center. And then you have individual doctors that have also their own software. And then you have everybody that have their own system, and they kind of talk to each other, not very well today, but it's improving. And we created Andaman as a distributed system from its foundations. So anybody around the patient, including the spouse or the parents of the patient, can enter, and of course the doctor and the nurses can enter data at the same time, and all of that information will be gradually exchanged with each other according to the access rights, of course. And so the distributed EHR is being enriched by several actors at the same time. So this is really a change of paradigm for health records. So in that sense, Andaman is, according to me, very different. It has a very different approach to other systems. I hope that answers.
If I can also add, I would say that if I interpret the question correctly, I think it's also asking around how do you shift the standard of care? And I think based on Ingrid's comments, with better evidence and more evidence, you can show the doctors that the outcomes are in fact better for your treatment. And so that's how Andaman7 or other digital outcome assessment tools can help you. I think another way to, what's super important in care, as we've talked about a little bit, is adherence to the protocol. And so empowering the patients and getting them involved in their own care through a tool like Andaman7 or other tools you might use is by itself going to increase the efficacy and use of your treatment or intervention, whatever it might be. And there's data on this. You can look at opennotes.org, which is a nonprofit that does research on the effect of outcomes on the patients being engaged in their care, specifically related to them having access to their data. And so I encourage you to check that out.